Hi there, this is Dr. Ajay Rote. I am a consulting diabetologist and CEO of United Cigma Hospital, Aurangabad. Today we are going to discuss few things about diabetes, insulin and the insulin pump. As you might be aware that India has become one of the greatest hub of diabetic patients. Till last year, India was labeled as the diabetic capital of the world with maximum number of diabetic patients in a single country. Now the number is quite high and there are many more patients who are still they don't know that they are diabetic, and those who know they are diabetic still they are not taking a good quality treatment and not maintaining their sugars properly. Diabetes, if we think of in simple terms, is basically what we technically call hyperglycemia, that is rise in blood sugar level, with the reasons behind. One is insulin resistance, another is insulin deficiency, and its associated complications which may develop later on. Now the diabetes per se has been broadly divided into four different categories. The first and foremost is called as type 1 diabetes. It usually is developed or is found in children and young adolescents, although now this borderline has becoming very blurred and it is now found at later ages also. But the problem in this case is the insulin secretion in the body has gone down so significantly that it is close to zero. So these patients, these type 1 diabetic patients, require insulin for their survival. The second category is called as type 2 diabetic patients, and by far this is the maximum number of diabetic patients in the world as of now. And out of every 100 diabetic patients, 90 to 95% patients would be type 2 diabetic patients. Now type 2 diabetes process starts with insulin resistance, and later on there is insulin deficiency, which leads to development of diabetes and associated complications. The third type is gestational diabetes mellitus, which occurs during pregnancy, and the fourth variety is called as the secondary diabetes, which develops due to some other hormonal imbalances. Now there are this distinction is quite intermingling, and there is one category which is called as type 1.5, which has got features of type 1 as well as type 2 both together in that. But to put it simply, we have seen that there is an insulin deficiency, which is a common factor in almost all types of diabetic patients. Insulin resistance is also equally important. Now briefly we will see what is the status or what is the normal physiology of a human being. Nature has bestowed us with pancreas, which has islets of Langerhans, and there are beta cells into the islets of Langerhans which secrete insulin. The normal insulin secretion is basically of two types. One is we call basal insulin secretion. So whether we eat something or not, some amount of insulin is continuously secreted in the body. The another variety of insulin secretion is bolus insulin secretion. So whenever we take food intake, according to that insulin is liberated, and that is called as bolus insulin secretion. So the both basal and bolus, and that is how the sugar levels, the blood sugar level, the sugar level in the blood is maintained very closely, very tightly controlled, and it is maintained in the normal ranges in those patients who do not have diabetes. Now what are these normal levels of blood sugar level? So if you see your fasting, that is empty stomach after a fast of around 8 to 10 hours, the blood sugar level range, the normal range is in between 70 to 100 milligram per deciliter, or which is also called as milligram percent. And 2 hours after a food intake, 2 hours after the start of food intake, the blood sugar should be in between 100 to 140 milligram percent or milligram per deciliter. There is a third important diagnostic as well as prognostic marker in diabetics, that is called HbA1c. Now this HbA1c is also called as a glucose memory test, and the normal range of glucose memory test, it should be less than 5.4%. It is in terms of percentage. It has got a 3 months average. Now we call a person, irrespective of the type, we call a person as having diabetes when the fasting sugar level is above 126 milligram percent, the post meal sugar level is above 200 milligram percent, or HbA1c is above 6.5 percentage. So if any of these criteria are fulfilled, we consider that this patient is suffering from diabetes. Now there are various ways to treat diabetes. Now our concern and our topic of interest today is insulin pump. There are various means and ways to control and to keep it under control. Unfortunately, there is no cure of diabetes as of now, despite more than 100 years of research. But the basic phenomenon, as you are aware now, you are aware that the basic phenomenon behind all the types of diabetes is deficiency of insulin. Some kind of deficiency of insulin is always prevalent in all forms of diabetes. Now the best way of replacing insulin is by giving insulin. So the thing which your body does not produce adequately, then you have to take it externally. Unfortunately, we are not able to produce insulin in the form of tablets even as on today. So it has to be injected. It has to be injected below the skin. Now there are various devices by which we can inject this insulin in a virtually painless fashion. So one of the devices is the pen. There are so many beautiful insulin pens which are available, which even after injecting will not cause much pain, or it will be very little pain after injecting of insulin. Now those patients who require very high dosage of insulin, or like for type 1 diabetic patients who may require higher dose of insulin and who practically are completely insulin deficient, so there is what we call it as insulin replacement therapy. We have to replace the entire insulin in the body. Now the best way to replace insulin in the body is called as the insulin pump. Insulin pump, which is also known as an artificial pancreas, although the name is not correct because it does not reproduce all the functions performed by a normal pancreas. It reproduces only the endocrine, and that only the pancreatic beta cell function performed by a normal human pancreas tissue. Now insulin pump is a very small device of the size of a mobile, and it will show you, it will have insulin in it, around 3 ml of insulin or 300 units of insulin stored in it, and by way of a simple cannula, very simple cannula, the insulin is delivered in the body subcutaneously and continuously. So as we have seen earlier, the insulin in the body, which is secreted by two ways. One is continuous basal secretion, another is bolus secretion in response to food intake. Now this insulin pump, it liberates insulin at a predetermined rate. We can change the rate of the insulin pump, and it liberates the insulin in a predetermined rate, and there is a lot of variation and lot of ways, lot of rates we can set in. You can set rate every half an hour, so practically we can set the rate for 48 rates we can set for a day, so as to achieve a normal blood glucose levels. And another thing is, like, there is a bolus insulin. So in case of at the time of eating food, we have to again inject a button and it will deliver the insulin. Now this both the ways are actually painless because there is no needle inside. We have to just insert the cannula and it takes the insulin inside, so there is no pain at the time of injecting of insulin. Then this is a small and a discrete device, so you need not have to declare all the time that you are diabetic and you need to take insulin all the time. You need not carry the insulin pens along with you, so there is no hiding of insulin pen or like that. Then you can, there is no restriction, on the activity. It's a waterproof. You can take out the cannula and you can keep it disconnected for around 2 hours. Then it's a waterproof, so you can do your normal activities. Even swimming is possible. World over, many famous personalities, sportsmen, those who are having type 1 diabetes, they are using insulin pump quite efficiently, and they are doing their normal functions very regularly. Now the basic advantages of using an insulin pump is like it will help in achieving the good diabetes control, and what we call a good diabetes control is our HbA1c should be less than 7. Now there is a recent concept of good diabetes control, and there are 5 parameters when we consider it. One is fasting blood sugar level, another is post meal blood sugar level, third one is HbA1c, fourth one is no hypoglycemia, and fifth one is good quality of life. So we want to achieve all these parameters, and all these 5 parameters can be best achieved by using the insulin pump. Various models of insulin pumps are available. They are quite user friendly. In some of the models there is a remote control, so that you need not take out the pump all the time, and also the needle that remote has got a glucometer built inside, so you can just insert the value, just insert the strip reading, and depending on the reading the remote tells you how much dose is to be injected. So quite an intelligent way to manage a diabetes. So benefits of using this insulin pump or the artificial pancreas. Last year, if you have seen, it was in 2016 actually, the closed loop in insulin pump or the artificial pancreas was first approved by US FDA, although it is not yet available in India, but we are soon expecting it to be available in India. That is 670G, and this is an intelligent insulin pump. It decides how much is the sugar level and how much insulin is to be taken. The machine itself decides. It has got an intelligence devised into it. It also has got a hypoglycemia protection. So if you set a limit, there won't be hypoglycemia. So if sugar levels go beyond that particular, go down below that particular limit, there would be cessation of stoppage of function of the insulin pump. So you won't land up in hypoglycemia. Now there are various studies, trials, and research conducted on the use of insulin pump. It has been found that the best possible diabetes control can be achieved for diabetic patients. Guidelines say that these are to be used for type 1 diabetic patients. This is like a boon for a type 1 diabetic patients. Even for brittle diabetics in type 2 diabetic patients who require very high insulin and who need to have very tight diabetes control, using insulin pump is very good. There are trials to say that the patients who are having diabetic neuropathy benefit a lot, and the symptoms are reduced with the use of insulin pump. Even patients who are having erectile dysfunction have been benefited by using the insulin pump. So till the time there is a pill for insulin, which we are expecting, we don't know whether it would come or not. Till the time, the best way to take insulin and to manage diabetes and to keep it under control and to improve the quality of life, insulin pump is one of the best options. So this is a device which is the size of even smaller than a mobile, and it can definitely be useful. And as you can see, this is a small cannula. This device you can fit it here, and this is the cap. You can just remove the cap, and the cannula inside is waterproof. So you can fit in the cap and you can remove it whenever is required. And this is the part where insulin is stored, around 300 units of insulin. So there is a very basic model of insulin pump, but we suggest you to go in for take a trial of using insulin pump, and definitely it is the one of the best ways to manage diabetes, to keep your diabetes under control, and to manage diabetes in a painless fashion, and to prevent all the further complications of diabetes which occur mainly due to deficiency of insulin. Thank you and have a wonderful day.